এজন বাচ্চা মানে ছোৱালী এগৰাকী 1 year 3 months old তেখেতৰ মানে জ্বৰ পানী লগা আছিলে কাহ আছিলে আৰু লগতে অলপ ৰেছপিৰেটৰী ডিষ্ট্ৰেছ আছিলে তাৰ কাৰণে আমাৰ চিভিল হস্পিটেলৰ পিডিয়াট্ৰিচিয়ানক দেখাইছে তেখেতে মা দেউতাই তাৰপিছত মানে অলপ মানে অসুবিধা হোৱাৰ কাৰণে মেডিকেলত ৰেফাৰ হৈছে SMCH তাৰপিছত মানে ICUত এডমিশ্যন আছিলে কিন্তু মা দেউতাই মানে আৰু ৰাখিব বিচৰা নাই বাচ্চাৰ কণ্ডিশ্যন চাই বোলে ঘৰত লৈ আহিলে অন দ্য ৱে বাচ্চা ঢুকাইছে তো আমাৰ SMCৰ পৰা মানে যিটো ব্লাড ৰিপৰ্ট আহিছে H1N1 ইনফ্লুৱেঞ্জা এণ্ড H3N2 ভাইৰাছ এইটো মানে তেনেকুৱাও মানে কোনো মানে কণ্টেক্ট হিষ্ট্ৰী নাই যে কোনো পিগাৰী বা কিবা এনিমেল চ'ৰ্চ কিন্তু আমি মানে এটা মিটিং হ'ব কালি আমাৰ ভেটেনেৰী ডিপাৰ্টমেণ্ট আৰু এলাইড ডিপাৰ্টমেণ্টবিলাকৰ লগত আমি যি মেজাৰ্ছ ল'ব লাগে swine flu হৈ আতংকিত হ'বলৈ আমি ৰাইজক নহ'বলৈ অনুৰোধ কৰিছোঁ আৰু মানে আমাৰ যিখিনি মেজাৰ্ছ ল'ব লগা আছে আমি সেইখিনি লৈছোঁ এক্টিভ ছাৰ্ভেইলেঞ্চ চলি আছে আৰু আমাৰ হেল্থ DSO ছাৰ্ভেইলেঞ্চ টীম ডিষ্ট্ৰিক্ট IDSP টীমো গৈছে তাত আৰু এলাৰ্ট আৰু এৱাৰনেছ এইবিলাক যিখিনি কৰিব লগা আছে ছাৰ্ভেইলেঞ্চ আমাৰ হেল্থ ৱৰ্কাৰ কৰি আছে এতিয়ালৈকেতো তেনেকৈ পোৱা যোৱা নাই আৰু এটা ল'ৰা আছে কাটাকাল এৰিয়াৰ পৰা 13 বছৰীয়া ল'ৰা তেখেতো মানে SMCত এডমিট হৈ আছে আৰু তেখেতো অন দ্য ৱে টু ৰিকভাৰী আৰু আমি ৰাইজক মানে অনুৰোধ কৰিম যে আপোনালোকে যাতে কোনো চিমটম থাকিলে ডক্টৰক দেখাই পেলাই কৰে আৰু ল'ৰা ছোৱালী যদি পানী লগা জ্বৰ তেনেকৈ থাকে স্কুলত নপঠাই সিহঁতক অলপ আইচলেশ্যনত ৰাখি ট্ৰিটমেণ্ট আৰম্ভ কৰিবলৈ অনুৰোধ কৰিম
Actually, in Hailakandi district, one patient named Farhana Khanon Begum Bhorbuya. Her age is 1 year 3 months old. She has got all the vaccination up to 1 year. That is up to MR and JE vaccine. All the vaccine has been received by her. Now, the thing is that she has developed fever on 28 at her house. On that day, their parents have not contacted anyone, but on 29, they have come to Eskeroy Civil Hospital in OPD. And there, Dr. Haris has checked up at OPD, and he advised the guardian to admit the child. But the party refused and they left home. So on 3rd, again, they have brought the child and admitted in Eskeroy Civil Hospital. So on that day, the child has been received all the necessary treatment. But as it is not improving, on 1st, Dr. Shamsul Hoda, child specialist, she has gone through the child, he has checked up, and then he referred the child to Silchar Medical College at around 9:10 p.m. So the child was shifted by 108 to SMCH. And after reaching the SMCH, the child was kept in ICU and necessary treatment they have given, ventilation has been given. Then on 2nd, they have collected the sample and they have tested it and they have received the report. They have given the report on 4th May. It was written in the report that influenza H1N1 and H3N2. So in that conclusion, we are come to the conclusion that it is a type of influenza. So that child, after staying there in ICU, they wanted to take the child home against the medical advice. So they have took discharge from the medical college and they went back home, and on the way at around 6 p.m. the child has expired. So yesterday we have visited the area. It was under Lala block at Behul, under Behul sub-center. We have visited the residence of that particular child, and there were 4 members, mother, father, child, and their grandparents. So we have informed them to stay isolated, not to be communicate with other neighboring for 7 days at least. And I have informed with all the, I have met all the health workers, frontline workers. They are doing the surveillance. So I have informed them to follow up to 7 days if any kind of fever has been reported from that particular area as well as from the family members. And they are doing the surveillance at least 20 to 30 houses they are covering every day. This surveillance has been started in Hailakandi from last month because it is a rainy season. So different types of disease may occur during this season. So I have informed all my surveillance team that any kind of fever with rashes or any kind of fever with breathlessness, cough, loose motion, or whatever any kind of disease should be reported on daily basis in the platform of IHIP platform. So every day they are reporting. Now the precaution that what we are thinking to, what we are planning and what we have given the direction to the frontline workers is that every day they should report whatever they have visited, the surveillance, how many house has been visited, what are the condition of those house visited members, is there any kind of disease, cough, fever is there, any loose motion is there, and I have informed them, the frontline workers, to take this zinc tablet, ORS, as well as paracetamol along with them, so that any kind of fever case detected, so that they can give paracetamol at least, or diarrhea case detected, they can give ORS and zinc tablet, and they should inform immediately to us, to the IDSP department, and if possible, they can contact the 108 ambulance and they can refer the patient to Esqueroi Civil Hospital. That is the thing that we are doing, and tomorrow we are going to plan one DTF meeting also along with the line different departments like veterinary departments and PHE department. So we have already contacted with the local area people also in that particular where the child has died. We held an awareness meeting yesterday, and I have confirmed that all the public, they cooperate us, and they say that any kind of fever or any kind of diarrhea or any kind of anything happen in this area, they will cooperate and inform us. They have given the assurance.
We received 5 cases of swine flu, out of which 4 are from Kachar district and 1 is from Hailakandi districts. Out of 5 patients, 1 patient already recovered and got discharged from Silchar Medical College. Another patient was one girl patient, 1.5-year-old. Her condition was little bit critical, and she was suggested for ventilation support. But after that, the patient party refused that, and they take away the patient from Silchar Medical College.
And what is the procedure of finding these symptoms and everything?
Actually, swine flu is almost like is a variant of your influenza viruses. So the presentation of the patient is almost same like that you are with your common flus, like fever, respiratory difficulties, temperature, even body ache, and some in difficult situation there may be respiratory distress also.
And
Actually, for confirmation, patient usually comes with this type of clinical complaints like that of your flu-like presentation, like your fever, cough, respiratory distress, even body ache, pain, like this. And in case of doubtful situation or conditions, we send the patient for laboratory test. And in Silchar Medical College, we have got PCR facilities, and with the PCR testing, we can able to detect the viruses responsible for the swine flu. Actually, swine flu for normal people is not a dangerous situation because it is almost like an influenza-like presentation, which eventually occurs in is a very common in these climatic situations. But those people who are in the or having the comorbidities like elderly people, people with high or uncontrolled diabetic, the patient is having some respiratory problem, previous respiratory problem, or patient on chemotherapy or immunity status is little bit compromised. These are the high risk people who need prompt treatment and early interventions. Well, it is not a matter of concern right this moment. Till now, in this season, there is no death reported from Silchar Medical College's swine flu. Silchar Medical College is very much ready to face any kind of swine flu related illness because we have got adequate number of our ICUs beds available. We have got ventilator support if patient required for this, and we have got all the medicines available for the treatment of the swine flu. So it is not a matter of great concern, I believe, right this moment for Silchar Medical College to tackle swine flu. Swine flu is almost basically is influenza, but less severe than that of the COVID. So we have managed COVID in very successfully, all the three waves of COVID in entire Barak Valley. So in that comparison, swine flu is not that much of severe enough, and we are always ready to face this type of difficulties. And Silchar Medical College has got adequate infrastructure with both support from our dedicated doctor streams, our paramedicals and nursing staffs, and as well as our infrastructure structure wise. Silchar Medical College have no deficit in terms of the management of the even swine flu comes in larger way also.